So again, we see all this misty mesentery. You've got this relative mass effect, this clear delineation of the tumoral pseudocapsule, the fat ring sign, and then again some nodes. Mesenteric paniculitis, what do you guys think? So this is an example of lymphoma, right? So lymphoma is the most common malignant tumor of the mesentery. It's seen about 30 to 50% of patients with non-Hodgkin's lymphoma, and there's a lot of overlap with sclerosing mesenteritis, both forms that we discussed. So lymphoma, fortunately, usually presents with multifocal disease. So, this is a more flagrant case, obviously, but you can see that in addition to the mesenteric involvement, there's also a lot of involvement in the retroperitoneum. And when you see this here, this is frequently described as the sandwich sign, where you can see this involvement of these two leaves of the mesentery and this relative preservation of the vasculature and fat in between, looking like a sandwich, right? So one thing that's very helpful is to remember that untreated lymphoma does not calcify. It can in super high-grade cases, but for all intents and purposes, if you see calcification within these mesenteric masses, you can eliminate lymphoma from your differential diagnosis. So what are the worrisome features? We've kind of already alluded to them. One is lymph node size. If it's 10 millimeters or more in shortest axial dimension, you definitely want to be working that up. And you certainly want to be looking for lymphadenopathy in other regions, because if you have it outside of the mesentery, that's concerning as well. The literature has shown if one of these features is present, you have a sensitivity of 100% and a negative predictive value of 100%.